Good morning once again, and welcome to part 2 of the Determinants of Health. I hope the previous lecture was comprehensive and clear, and feel free to contact me at any time if you have any question or inquiry. At the end of today's lecture, you are expected to give examples of determinants of health, be able to recognize the social determinants of health, which is one of the important aspects of or important factors for health determinants, and understand the link between socioeconomic determinants of health and health inequality. So at the beginning, I'd like to remind you with the determinants of health, which are factors that influence health and cause variation in health status across communities and individuals. And as you can remember from the previous lecture, they are divided into two aspects. The proximal and the distal depends on how directly it affects on health. So the proximal factors are the one that affects directly your body, where you have the choice, where you can modify, where you can avoid. And then the distal, the one that indirectly affects health and are mainly found at the macro level or higher levels, which might be beyond our choice and beyond our control. So this figure shows some of the main factors that influence health and quality of life. So to start at the middle portion of the diagram, you can see that material and social deprivation, lifestyle and behavior, the genetics and family biography are one of the important factors. And then at your left side, or the left hand side, you can see that the national and local policies, information media, education and employment. And then at your right side, you can see that the qualities of the environment, for example, pollution, access to health services, again affects health. And as you can see here, these factors are interrelated with each other. So we understand that health is mainly multidimensional and systemic. Among the factors that have a significant influence on health are the socioeconomic condition of a person. Evidence has shown that the social inequalities, especially when it comes to the deprivation and poverty, affects inequality in health and well-being. So we are going to talk in the coming slides about the social determinants of health as one of the main factors that directly or severely affects one's health. So what are the social determinants of health? Based on WHO definition, they are defined as the conditions in which people are born, grow, live, work, and age. So these are the non-medical factors that influence health outcome. And also, these conditions are shaped by the distribution of money, power, and resources at different levels. So what we can understand here is that health is fundamentally shaped by income, education, working conditions, and other forms of socioeconomic factors that are located outside the healthcare system and individual choice. And we need to keep in mind of these factors whenever we are trying to target any problems within the public health, instead of just focusing on individual related factors like genetics, lifestyle, or health system and health service access. So the social factors that affect health includes gender, age, genetic factors, which are individual-based factors. They also include factors related to behavior, such as exercise, diet, unhealthy habits like tobacco smoking, alcohol consumption, and drug abuse. Moving further in the hierarchy of social determinants, you can find that there are other factors that are more of socioeconomic, including the disability, working condition, employment, income, and education. So it's really important to understand and recognize these social factors because the differences in social status creates social gradient which leads or contributes to health inequality. So again, the impact of social determinants of health are significant, are large. They contribute to health inequalities and lead to unfair and avoidable differences in health status within communities and countries. And there are many reports and surveys that have found that social determinants of health leads to 30 to 55% of negative health outcomes within communities. So just to give a simple example on the impact of social factors on health is that when you look at the poor communities, you'll find that the poor are more likely to suffer illness during their lifespan because they have more exposures to risk factors. And in fact, the WHO has targeted these factors and recommended policies and interventions in order to deal with addiction, food, stress, social exclusion and discrimination, unemployment, work, and transportation in order to enhance and to improve public health. This is the rainbow model by Dahlgren and Whiteheads, where they describe the social factors that influence health at different levels. It's commonly used and utilized by the social epidemiologists to describe these factors and to target them. So again, it's very important for you to know it and understand it. So these socioeconomic status can be measured in order to assess or examine its impact on health. So one of the tools that is commonly used is by measuring the social factors at individual level by using the socioeconomic status, where you ask the people about their occupation, income, and education. And I'm sure that all of you are aware of these methods of asking patients about their socioeconomic status that is commonly used in surveys and research. However, you need to keep in mind that socioeconomic status is a complex concept with different dimensions. So for example, if you have a person with low income living in a rich country where they have lots of free services provided to their citizens, including education, free healthcare, you can't correlate the low socioeconomic status in such situation with health. Okay, so we could consider that the socioeconomic status is a bit complex. However, the general rule that a low income community usually have a poor health. Another tool used in measuring the social factors and its impact on health is by the index of multiple deprivation, where usually it is used to assess the status within communities and neighborhoods. So basically, the index of multiple deprivation is used to measure the inequalities, the social inequalities or social gradient at neighborhood community level, established and implemented in the United Kingdom. It takes into account 7 domains of communities, looking at the typical income, employment status, educational level, health, crime, barriers to housing services and living environment, and gives it a score, usually from 1 to 10 or 1 to 2,000 based on the number of these societies or communities. And it's a very reliable and feasible measure to assess the social status at the level of communities. So this is an empirical map of the United Kingdom where the IMD or the Index of Multiple Deprivation have been used, where they ranked the societies or the cities or in England from 1 to 32,000, from most deprived to the least deprived. The darker the color shows the most deprived, the most poor communities. And then from here, they start assessing the health status versus the deprivation index to assess whether there is a correlation between health and the social gradient. And in fact, there is a linear association most of the time between the social status and the health outcome. After talking about the tools that are used to evaluate the social gradients, there are many studies that have utilized those tools in order to assess the impact of social gradients on health outcome, especially on the prevalence of non-communicable disease in one group versus the other. And it has been found that the social gradient had a direct impact on life expectancy, cardiovascular disease, cancers, diabetes, overweight and obesity, and mental health. And we are going to talk about these different comorbidities in the coming slides and the effect of social gradient as an influencer of non-communicable disease. So let's look at the social gradients in health in terms of the gradient in life expectancy, which is an area of interest for most researchers in social epidemiology. And in fact, it's really interesting to look into this subject. So the graph here shows the relation between deprivation status or poverty among male and female in relation to life expectancy in the UK. So looking at the y-axis, which reflects age, and the x-axis, which represents deprivation status, from most poor in the left end and least poor at the right end. And you have the green line representing women's age at death and the blue line male's age at birth. So basically what we can see here that both male and females from deprived communities have shorter lifespan compared to their counterparts. So, and at the same time, male have less lifespan or shorter life expectancy compared to females. So this social gradient in life expectancy, did it happen by chance or is it real? Okay, let's look into the next slide. The United Nations has released a report regarding the life expectancy across the globe, and it showed that there is a similar trend of longer lifespan in individuals residing who were born in countries with least deprivation, where there are more resources and life opportunities, and vice versa. Another health outcome from the social gradient is inequality in premature death, which is death before the age of 55, or based on England's healthcare system, death before 75 years of age. The national statistics in the United Kingdom report showed that the premature death from heart disease and stroke was highest in the most deprived group and lowest in the least deprived. Now, let's look at the distribution of malignancies across the different social classes. According to the Cancer Research UK, as shown in the graph, the incidence or the age-standardized incidence rate of cancer was higher in the most deprived group and lower in the least deprived. But keep in mind that there is some type of cancer, as you can see in the graph, are more common in the least deprived or the advantageous group, the rich people. So for example, when you look at breast cancer, you can see that the gap between the lowest and the highest deprivation group was -14%. So the least deprived are facing higher rates or higher incidence of breast cancer compared to the more deprived population. And this is attributed to some practices, behavior, lifestyle that are seen in advantageous or the rich societies compared to people in poorer societies. So in the case of breast cancer, women from least deprived try to avoid multiple pregnancy, which is considered a protective factor for breast cancer, which also explains the low prevalence in deprived areas. Another important public health issue, which is obesity and overweight. Again, there is inequality in the prevalence of obesity across the different social classes. And as you can see in the graph, that people from the most deprived areas are facing higher levels of obesity and overweight. And on the other hand, people from least deprived societies are facing lower rates or lower prevalence of obesity and overweight. Evidence also showed that there is inequality in mental disorder prevalence and incidence. So there is a survey from the UK done in 2007 showed that the prevalence and incidence of mental disorders were very common in people with lowest income compared to those with highest income. And just to clarify the graph, the dark blue bar represents men and the light blue represents women. So as you can see that there is a gradient in the prevalence of mental disorders across the highest income versus the lowest income and among male versus woman. So in general, or in summary, the mental health disorders were very common in households with the lowest income and in females compared to those with highest income and male. I hope that you are all able to recognize the link between social gradient and disease. The next thing that we need to learn here is understanding the reason for this association. What explains the social gradient in health? There are many theories that explains it, but one of the most famous theories has been proposed by a psychologist called Bartley, where he believes that there are four aspects that determines or that leads to social gradient in health, which are cultural behavior, materialistic perspectives, psychological, and life course. So let's start with the cultural behavioral approach, where it proposed that there is a link between difference in health-related behavior across social classes, which determines health outcome. So let's look at some of the health-related behavior. So smoking, alcohol consumption, dietary intake, physical activity, risky sexual behaviors, and health service usage. So these are different practices or different behavior that varies across the social classes, which then creates the social gradient in health. So this is one of the explanation how social gradient affects or leads to health inequality. So let's look at a real example of the effect, or how did the cultural behavioral approach explain the social gradient in health. So for example, tobacco smoking in the UK is inversely correlated with socioeconomic position, where smoking prevalence is 2.5 times higher among UK adults who work in routine and manual jobs compared with those in professional and managerial. The reverse is found in terms of alcohol consumption. So alcohol is highly consumed among those who work in managerial and professional occupation than in those in routine and manual occupation. So again, you can see the variation in alcohol consumption between or across the social classes as seen in the graph here. Another example of the cultural behavioral approach is that women from the ethnic minority are less likely to attend cervical screening programs. So for example, in the UK, it has been found that certain groups, for example, the Indians and Bangladeshi women, are less likely to attend the cervical cancer screening due to some cultural and beliefs related to their religion, related to their faith, which led to screening inequalities, and strategies have been implemented in the UK in order to tackle this problem. Another concept produced by Bartley is the materialistic explanation. So basically, he proposed that factors related to environment and the structure of a certain community or a certain country has been related to social gradient and health inequality. So anything that is associated with income, access to food, services, goods, power, and prestige contributes to social gradient and equality across different social classes. So another example is physical hazards at work. So a group of people might be exposed to poisonous agents or are more prone to occupational injuries, keeping them at risk of health hazards or health harms compared to those who are at managerial or professional jobs. Another example is housing quality, so damp and mold homes are associated with respiratory illnesses. Another example of the materialistic explanation of social gradient in health is that the low-income communities tend to consume poor quality food in order to be able to stretch a restricted food because of their budget or because of their low budget. So at the same time, they are at risk of being underweight due to the poor quality food. So we need to consider these materialistic reasons for the social gradient in health or health inequality. Now let's look at the psychological factors that explains the social gradient in health. So generally, it has been proposed or it has been shown in different studies, and there are large studies and research that have been done studying the effects of stress, the prolonged stress on health. Okay, it has been shown that long-term exposure to stress leads to a cascade of molecular changes in the body. So this cascade and this pathway, if it is recurrent and persistent, then it has negative effect on the body. And as you know that there is an association between stress and increased atherosclerosis and hence increase the risk of cardiovascular disease events. And it has also been shown that acute stress can trigger myocardial infarction in people with underlying cardiovascular disease. Besides that, stressors or having chronic stress in life might lead to certain or risky behaviors that puts life or health at risk. Another interesting side of the psychological explanation for social gradient is the perceived social status, what a person thinks about himself or what a person believes about himself in terms of his social class. A clinical trial have been conducted in non-human animals, and it showed that the monkeys at higher social order live longer than ones in subordinate position. Another example, the Hollywood actors, Oscar winners, live almost 4 years longer than nominees who didn't win. So these are all different examples of psychological explanation of the social gradient in health, and you can find that most of them are based on observational studies. So the last concept that has been proposed was the life course perspective. So basically, They propose that health is strongly related to whatever social, psychological, biological, and economic factors that a person have gone throughout his lifespan across time, even in the period when he was a fetus. All these factors together with time determines one's health. So how health later in life is shaped by early experience across life. So this is a very interesting part of social epidemiology, which is the life course epidemiology, and it has various explanations for health inequality. And I believe that the more you understand about life course perspective, you'll find that it makes sense. That yes, whatever a person goes through in his life can determine his health later on. So this graph gives a simple explanation of the life course perspective. What it shows that health potential across lifespan from time of birth and onward. So when you look at the upper line describes the optimal life trajectory and how it is associated with better health compared to the bottom line, where health potential and well-being is associated with a lifetime trajectory or pathway across the lifespan. With social inequality, individuals get exposed to more and more risk factors throughout their life, and this makes them at higher risk of poor health and disease later on in life. This is an interesting observational study that looked at the association between the exposure to interpersonal racism and infant birth weight. And they found that more infants with low birth weight were born from mothers who have exposed to racism. Other studies in life course epidemiology have shown that there is an association between early childhood economic deprivation and psychological trauma, or experiencing adverse events during childhood was associated with chronic disease later in life, or even premature aging and mortality. So the life course perspective is an interesting side that explains the social gradient in health and health inequality, where it combines the different factors that we have discussed earlier that a person might experience throughout his lifespan, causing disease and illnesses later on in life. And to conclude the talk about the life course perspective, you need to understand that knowing and recognizing the life course model is essential for developing effective strategies to reduce and ultimately eliminate the social disparities or the health inequalities, and to reach to a better health for all. So far, we have covered different aspects of the social determinants of health, starting with the definition, looking at examples of social determinants of health, various types of diseases that are caused by the social gradient leading to health inequality of these chronic diseases or these health problems, and then we talked about what explains the social gradient in health. Now let's focus on a different aspect, which is the effect of age on social gradient. As you can see in the graph, there is an inequality in death rate. So the mortality rate in relation to age. So as the person ages, the risk of death increases regardless of his occupational status. For age, let's look at gender. Gender is also responsible for health inequality. As I think as medical students by now you are aware that women live longer than men, so women have longer life expectancy than men. A health survey of England in 2017 showed that women are less exposed to diabetes, Cardiovascular disease prevalence is less than women. However, there is high rates of chronic pain in general and high blood pressure in women compared to men. And what explains the health inequality across gender is that the difference in health status of men and women is related to biological, the practices of medical care access, social roles, the social status, the income, the economical level, and the stereotypes of femininity and masculinity. So these are the proposed reasons for the health inequality due to gender. So another aspect of gender inequalities in health is looking at the health-related behavior. So you can find that there is a variation in health-related behavior in men compared to female. For example, tobacco use, alcohol consumption, drug abuse, risky sexual relationship. But you need to understand that these variation in health-related behavior resulted from socialization process. So in many societies, women are less likely to smoke or drink heavily, and with time, things changed, especially in the Western societies where women started to seek some of these behavior, for example, tobacco smoke, as part of or as a sign of being independent, powerful, which made her at higher risk of lung cancer and disease compared to previous periods. As you can see in this graph, which displays the tobacco smoking or the tobacco use in males and females in the early 1948 to the 2000, after 2010. So as you can see that a male uses more tobacco, consumes or smokes more than women, especially at the early years, and then with time you can find that after 2000 there was a convergence where the rates of men and women are almost the same. So although there is a decline in overall tobacco consumption, but you can see that women smoking is still converging with male smoking and did not really decline compared to the decline that happened in male smoking. As a consequence of smoking, you can see from this graph the risk or the incidence of mortality from lung cancer between 1985 to 2011 across men and women. So as you can see, there is a marked decline in the prevalence of lung cancer, or the mortality rate from lung cancer in men, but the rate was stable among female, which is explained by the higher rates of smoking by women. So let's look at alcohol consumption in men versus women. So as you can see that the rate of alcohol consumption declined in men and in women, but the decline was less among females. So there is a gender orientation that affects this behavior of alcohol consumption, and as a consequence, the risk of disease, the risk of hepatic diseases and various comorbidities from alcohol consumption might be increasing in women compared to men. So let's look at a different aspect of gender differences and health inequality, and which is the physical activity. So this is a study that looked at the prevalence of physical activity across men and women, and in summary they found that men did more physical activity compared to women, and as older men, or in general, the older the individual, the higher levels of physical activity was achieved. Another aspect of gender differences and health inequality is the difference in the prevalence of common mental disorders in men versus women. So as you can see that more mental diseases were diagnosed in men compared to women based on the Adult Psychiatric Morbidity Survey. And this was explained by that women are more likely to seek medical help, so it's more about the health-seeking behavior, okay? Could be that less socioeconomic earning in women compared to men that made her more susceptible to mental disorders. And also women are at risk of domestic and other kind of violence that make her again at stress, leading to mental disorders and gendered processes regarding body image. So the stress from keeping up with a certain standard of body image might also contribute to the psychological variation across genders and leading to inequality of health. So far we have covered age, gender, and now let's look at ethnicity and its association with health inequalities. So this is a study or a survey that looked at the prevalence of overweight and obese by ethnicity. And it has been shown that the prevalence of overweight and obesity was higher among the Black population, followed by the white British, and least in the Chinese, followed by the Asian. So the variation across the ethnic groups in terms of obesity might be an alarming sign, causing health inequality. Again, the same trend is seen here. This is a study that looked at death by race and ethnicity, and specifically it was about chronic disease-related deaths. So the Black or African American had the highest mortality rate compared to other ethnic groups. And the least was with the Asian or the Pacific Islander. What explains the health inequality in terms of ethnicity? So basically, health disparities between ethnic groups are caused by differences in genetic factor, environmental, and health behaviors. And also, it has been found that the socioeconomic factors, and we've already talked about it, have been correlated or related to social gradients and health inequality. Language barriers is also an important contributor to as a reason of healthcare limitation, racial discrimination, and we've already covered the subject of racial discrimination and poor health. Before I end my talk, I would like to share with you a different concept or important concept that you need to keep in mind when you talk about the social determinants of health. So, what about if health is a determinant of a socioeconomic status of a person rather than the reverse? So, what if health varies by socioeconomic position because health is influencing the socioeconomic position of a person? This would be a case in some situations, and this what is known as a reverse causation. So let's have examples. So for example, if you have a person with a health problem, with a chronic condition, this might affect his career trajectory. Or for example, a certain appearance or a certain stigma, and for example, having a psychological disease or having a certain disability might affect your social status around people, and hence might affect your social and your occupational status. Children with poor health tend to obtain lower levels of education and worse labor. later on in their life. So this is another concept that you need to keep in mind and is used very commonly in epidemiological research in order to study what social determinants affect health. Here we reach to the end of this lecture, but before I conclude, I would like to remind you that health reflects more than genetics and personal choice. In fact, it is multidimensional and systemic in nature. Thank you so much for listening. Hope this wasn't boring. Feel free to contact me through my email at any time. Thank you.